Hello again, it's Doug Smith. This is the 20 January 2017 edition of Portsmouth This Week, the voice of Portsmouth Town Hall. Our special guest today is Ray Davis, coordinator of the Portsmouth Prevention Coalition. I know you were on just a few months ago talking about the reorganization. I'll ask you how that goes as we get into this. But I think what we'd like to discuss today is the latest Portsmouth Youth Substance Abuse Survey that was recently conducted. And I guess first, could you explain a little bit about the survey itself? You know, who does it, who does it go to, how many kids take it, et cetera?
The survey that you're referring to is the student survey that this year, this is the first year that the state of Rhode Island, through the Department of Behavioral Health, Developmental Disabilities and Hospitals, PHDDH, required that all schools participate in this survey. It's very similar to the surveys that we have done 2 other times in the last 4 years, but this was the first time the state had assumed responsibility to do that. The survey is totally anonymous. There are no identifying marks on it or names at any point on the survey, and that information is in Portsmouth with 7th, 8th, 9th, 10th, 11th, and 12th graders. There was passive, I can't remember the word, parents were given the option to opt their kids out of that if they so choose. It's parents' right. Again, there's no identifying information on it. And Portsmouth has had a very good record thanks to the cooperation with the school department. We've had high numbers, we've had 80% of the students in those grades participate in these surveys over the last, like I said, we've done it 3 times. So that's given us a great body of information to actually look and see what we've been doing, what the substance uses are as they're reported by students anonymously, what we've done, and has it made any effect, or has it made an effect?
Sure, I guess.
And the trends in drug use as well.
Okay, and is this done by you all, the PPC, or is this a consulting firm? Or?
This is done through, the survey is done through the state, and it's administered in the schools either electronically, as it was, I believe, at the middle school, and by paper at the high school. And then that information is given back to the state of Rhode Island. It's processed through their evaluation, which was with the University of Rhode Island. And then that information comes back to us, and we've been presenting that to the town council, the school committee, to the faculty at the high school, we did it for the parents group at the middle school, and we're doing it for high school parents this coming Monday at 7 o'clock at Portsmouth High School Library as well.
Okay. And I think the fact that you guys get 80% participation means that the data is very reliable, statistically speaking.
It is, and John Matson is the consultant that we use for all our data around substance abuse, and he's done this around the state with several communities. And they go through the data. There's a process that the URI did and all evaluators do, where you can tell if there are consistent lies, I guess, to it. If somebody's saying, they just throw that out. So the data is called, and you would be surprised because we also do focus groups. It's not just the survey, and I want to stress that. It's a community needs assessment. We do the survey of the students. We also do focus groups with students. We did, and we meaning John Matson and myself, are the only people there. We've done the focus group with the 7th and 8th grade, a 9th and 10th, and we did an 11th grade. And we did 2 focus groups with parents, 1 group of parents in Portsmouth and 1 group of parents in Little Compton, because we have Little Compton students who come to our school. Okay.
And I would imagine you get ideas of what people are thinking about this through those kind of groups.
Absolutely.
As opposed to just the data, you know, yes, no, whatever.
And we also have key informants. When I say key informants, it's people who would have direct knowledge that about these situations, about students, about school. And
this would be like the school resource officers,
it could be. So that's all anonymous too, but it's people that are in the know that have a different perspective on things. And we look at all that information, which gives us a picture. What is the adolescent substance abuse? What are the adolescent substance abuse issues in Portsmouth, and what's being done about it?
Okay. And I would imagine they also inform or give you an idea of how you should change your strategy if necessary to start
That's,
getting at the problem.
I'm glad you said that. That is really our job, my job as a prevention specialist, and it's the reason that we have prevention coalitions in every community in Rhode Island. It's and our coalition, which I'm very proud of because they're all volunteers and made up from people from all over this community, and it's open to any citizen in Portsmouth to become a member of that as well. They're the ones that we go through this data and use tactics that are proven to be effective that other communities have done around this country and try and get them involved in Portsmouth. And we've done that over the years, and as we're going to get into this, we've had some positive results,
Yeah.
which is, I don't get to say that very often.
No, I was happy to see that myself.
Me too.
Just a sort of a side question here. Does anybody ever look at across the communities to kind of compare, say, Portsmouth with Barrington or with other communities?
I think what's more important than that, because every community is different, and I'm not trying to sidestep the issue, don't get me wrong. We look at it from a state point of view, which is extremely important for funding at national level and to try and get the state of Rhode Island, who has a huge problem. We're number 3 in the nation with substance abuse. It tries to direct programming and funds to be able to combat the situation effectively.
Yeah.
It's not just throwing money at something.
No, I understand that. I guess what I'm thinking, though, is people would like, just human nature, would like to know, well, okay, this is a snapshot of Portsmouth. What about Newport? What about Middletown? Well, how are we doing compared to everybody else? Again, that's kind of another step beyond what we're talking about here today. But can you talk about some of the key findings? There are several key things that I think, by the way, I should mention, the survey, the PowerPoint of the survey itself, the survey data, we're working to get that up on the Portsmouth Prevention Coalition page on the town website,
Yes.
as well as the school website. So parents can go on, click on the link, download the PDF, and actually read the whole thing.
There's been a redesign of the town's website. I've submitted that material to the town.
Yeah.
On the current website, they've got 2 years of previous data, but the newest data they don't have up yet, and I will
We'll work on
be
it.
on the phone with them to ask them to get it on there, because it is worth looking. And again, Monday night we're presenting this at the high school for anyone who would like to be there for that meeting at 7.
That's great. I think all parents of high school kids certainly should go to that. Okay, key points.
Key points. We ask several questions, and these are questions that are asked across the state. We ask about the age of onset, which is, when's the first time you as a student first started using alcohol, tobacco, marijuana, or prescription drug? Those are on the survey. There's also space to be able to talk about the other drugs, and we talk about those more in the focus groups. But those are the 4 main things. The reason we ask that question is it's a proven fact. And if you're a parent and you're watching this, I hope this is one thing that I really hope sticks with you. It's proven that the earlier a child gets involved with any substance, tobacco, alcohol, marijuana, whatever it is, the greater the propensity is for that particular individual to develop serious problems with substances down the line. So the more we can delay that, the better chances are that this young person is going to be okay.
Yeah.
Now, there's nothing happens 100%.
Okay, well, and we're going to talk about some developmental issues, too, that the
Right.
science talks about later.
Right. So we ask when they first started. And this is kind of across the board. There are some use at young ages, and I think one of the things that came out in this is that we saw a lot of young students who started, not a lot who have done it, but those that did say that they were involved with alcohol started at 12 and younger. Now that's not all of them. That's those that have said they've had some experience with it. That's disturbing. That's a young age. Cigarettes and tobacco has been taboo for students for a long, long time. We saw a little uptake in that, and we wondered why. When we dug a little bit deeper, it was primarily due to youth using vaping devices.
The electronic, the e-cigarettes.
The e-cigarettes,
Yeah.
which are not harmless as well. Alcohol is, the older students are, the greater the propensity for it. Marijuana as well. But here's the best part of what I'm going to say today is that There were downturns for the first time in every one of those categories. Alcohol, marijuana, prescription drug use. Tobacco was down just a little bit, and there was a little bump in the middle, but again, that was due to the vaping that we uncovered. I don't want to make it sound like our job's over, we've done a great job, there's not a problem. There is a problem. But this is the first time we've actually seen some results showing that what we have done as a community have made some differences.
So what kind of age are we talking about, generally speaking, of onset? When do kids do this, like in 8th grade, 9th grade?
14 through 17 years of age is when it seems to really start. There are some that start through 12 and 14.
Okay.
I think the more, and this is my own opinion, and I think a lot of people might agree, the more that we can do at that age in the beginning to deter this, the better off we're going to be.
Yeah. And that's why I think parents are so key to this.
Parents are the most effective prevention tool that was ever invented.
Yeah.
You know, I was joking with the camera guys on the way in, the older I get, the smarter my mother is. And it's true. I mean, you might think that kids don't listen to you, as my mother often thought, but it does. It resonates. Not only do they listen to you, they also see what you do.
Yeah, one of the things, too, that I thought was eye-opening in the survey itself, the PowerPoint for the survey, was the percentage of kids at the different grades that admitted to doing some of this stuff, like marijuana, alcohol, etc. And alcohol seems to be a perennial, really big problem.
Alcohol is by far the most abused substance by kids in Portsmouth and by kids in the state of Rhode Island. That is the highest number is alcohol. Now, marijuana is closing in on the heels of that as well. The alcohol issue, if we can talk about that just for a second, if that's all right.
Sure, please.
They're not buying the alcohol at package stores, at Class A vendors in Portsmouth, Tiverton, or Little Compton. How do we know this? Because the police departments do a great job of checking on those, and there's all kinds of tactics that police use, and they must report that to the state. The vendors in those Class A stores have done a very good job of not selling to minors. Kids tell us that they get their alcohol from their own home, either from, in a few cases, parents giving it to them, in more cases, stealing it from your liquor cabinet. Here's the big thing: if you want to do something for prevention, lock your liquor cabinet. And while you're at it, you might want to take a look at your medicine cabinet.
Yeah.
Or they have older siblings or older friends who give them alcohol. Alcohol seems to be the social drug that kids use in groups. Marijuana is a different story. Marijuana is, we ask a question about perception of harm and risk of students on all these substances. They all know that tobacco is bad for you, and they'll tell you that. I remember my friends saying, I quit smoking because I got tired of my kids coming home from grade school saying, Mom, Dad, you're killing yourself. It worked. Kids are telling me, you know, what's the big deal about marijuana? It's legal, which it's not, especially for, I'm talking about minors. It is medicine, which it is not. It has medicinal qualities to some degrees. That's a whole other issue we're talking about. It is not legal, and it is a drug. But kids have a different perception from the media, from the discussions. They see the paper where it's being discussed at the highest levels of government, and it is available everywhere. So it's a tough situation.
Yeah. The good news is there's some good news in this survey.
There is.
The usage is down somewhat.
Usage is down across the board, and I think that's a wonderful thing. That's really good.
Yeah.
But there are reasons why that is, and I think that's even the better part of it, is because, you know, people often say to me, when I tell them I'm a substance abuse prevention specialist, they say, "Oh, you're a counselor." I say, "I'm not a counselor. That's not what we do." we had these statistics that we brought to the town of Portsmouth, and I live in Portsmouth. This is my town, too. And Portsmouth had a reputation for a long time of sticking our head in the sand and not facing facts. And these statistics opened people's eyes, whether they wanted them open or not. It got them to listen. And over the course of the years, we've had the cooperation from the town council, from the school department, the school administration, from parents, from clergy, from the liquor stores. And what we've done, we went to the school department early on when Dave Croston was there, when we did the first survey, and they changed the chemical health policy at the high school to cover things that weren't in there before. Nobody knew about vaping and what was going on with some of those pens. So they tightened that up. They tightened up, they've changed the health curriculum to be more reflective of marijuana and other issues, and they've done a great job with that at the high school. Joel DeMarco, the head of the health department there, did a really good job. The whole Life of an Athlete program, where we concentrated on the athletes and having them live a more healthy lifestyle. Out of that grew the Patriots Committee, which is a group of Portsmouth students who make a pledge to not use substances. And they take that message to their peers and to the younger kids. And what comes out of their mouths and their actions is much more impressive to somebody in high school than anything I say or you say. Sure. Those things, as well as, you know, the town, the police department, all really pitching in to trying to do things, and people being, like Project Purple, I'm going to jump around a little bit. People say to me, well, what's a purple ribbon going to do about substance abuse? Not much. What it's going to do is bring people to awareness, because that whole purpose is for most of the kids at Portsmouth High School and in middle school do not use drugs or alcohol. Newsflash. They don't use, most of them don't.
Yeah.
When we did this, the parent focus groups in Portsmouth and in Tiverton, this is the interesting thing. Many of the Portsmouth parents said, well, it all comes from Tiverton. Our little Compton parents said it all comes from Portsmouth. And the kids themselves, we asked them, how many of your peers do you think use these things? Oh, it's got to be 95. Everybody does. Yeah. Everybody doesn't.
Yeah.
From the own surveys that we do with the kids, it's maybe that marijuana is maybe at the highest a third, which is too much. It's too much, but it's nowhere near what the perceptions are.
Yeah.
The other thing is, and I need to thank the police department, Chief Lee, and the town council and the school department, is the presence of a school resource officer in the schools. The students told us that they have seen a huge difference of what goes on in the school because of the presence of a school resource officer at the high school.
Yeah.
And Chief Lee, God bless him for his persistence, applied for this grant for 6 times. They finally got a grant now to be able, and there is now a school resource officer at the middle school as well.
Yeah.
They are very, very effective.
Well, I think you're right. I think perceptions are different from reality. But the reality is that substance abuse is not just a Portsmouth problem. It's a statewide, nationwide problem. And one of the things I think that kids look at this stuff and they say, well, you know, it's just not going to hurt me. But I think the science shows that especially kids when they start at an early age and they're heavy users of any of these things, it messes with their brains. It messes with their developmental capabilities. It'll determine whether or not they'll be able to be successful in college. So it's not just adults saying, don't do this, don't do what we do. There's actual science here, particularly for kids, say, what is it, under like maybe 25 or something?
There's a tremendous amount of science that is available now that wasn't around when I was a teenager a long time ago, that shows that the developing adolescent brain doesn't reach full development till around, I think it's like 24, maybe somewhere through there. The younger you are, the more that the more effect it has. And it has I'm not making this up, this is a scientific fact. It has an effect on a user, and it can affect the brain development of an individual, especially at a young age I'm talking about. It can affect, there's been increases in psychosis because the marijuana that is available now is not the same marijuana that used to be around. It is engineered to be genetic, much more potent, and the potency is a result of marijuana that was used for chemotherapy patients, and I understand that. I'm not disputing that, but that's not what's coming to kids. And it has a huge effect on them. I think the other thing, too, that this was pointed out the other day is that one of our biggest jobs in Rhode Island is the defense industry. You want to try and get a job with
with a drug background?
With a drug background?
Yeah.
Good luck.
Yeah. Well, I guess if I was a kid and you were saying this about beer or something, that would scare me. That's the one thing. I mean, I figure my brain's not that great anyway. Do I really want to lose IQ points by doing this stuff? But we got other issues here. Massachusetts just legalized marijuana use, although I have to say that they seem to be sort of backing off a little bit until they get their ducks in a row on that. And there are people in the state of Rhode Island that would like to legalize marijuana as well. What is the PPC's take on that?
Okay. I need to explain this. I work for Prevention Coalition. I work 20 hours a week. I'm paid through the town, and I'm paid through the state of Rhode Island through the behavioral BHDDH. All the money, and it's all that money, and I'll tell you how much that really is, from the state is from a federal block grant. There are nothing, no state monies that come to any of the prevention coalitions in that. It's all federal money. Because I receive federal money, I am not permitted to make any statements about any pending legislature, pro or con, because it's construed as lobbying.
Okay, so you're saying the state actually gives you all prevention no money. They act as a throughput for the federal funds.
That's exactly right.
Okay, to me that's incredible. I know a lot of people are concerned about this. Our new state senator Jim Seveny, for example, is very interested in hoping to try to change that. But that to me is amazing because it's certainly a statewide, if not a nationwide, issue.
It is, and it concerns me for a number of reasons. One is that I've been doing this job in Portsmouth for 6 years, and I work 20 hours a week out of my house. Most of the equipment I have is all my own that I purchased. I have a college degree. I have 3 certifications at the highest level of substance abuse prevention. I've been doing this work a long time in Newport County. I'm paid, and I got one raise. I'm paid $28.84 an hour for 20 hours a week with no benefits. And I work between 20 and 45 hours a week. And I do that because that's what the job pertains. The state of Rhode Island had been, up until January 1st, giving the town of Portsmouth $19,196 a year.
From the state?
From the federal government.
The federal government.
No
okay.
state money.
Okay.
We used to give $19,000 of that to pay for the student assistance position at the high school, so we had $196. That's changed as of January 1st because we've regionalized prevention, and now Portsmouth will receive $833 a month to pay for my salary from the federal government grant that goes to the state of Rhode Island.
Okay, so what we need to do is get more money so you can do more stuff with your programs.
Absolutely, because the town does contribute money to it, and we have Clements Market receipts.
Yeah.
And that's not funny. I appreciate that.
No, understood.
We've
Those
done
are
lots of
community
things.
support
right.
people. Yeah. You guys are all volunteers, as you mentioned earlier. How can people join if somebody says, "Geez, I'd like to get into this because I think it's important"? What do they do?
Well, we meet on the second Wednesday of every month at 8:30 a.m. at the town hall in the second floor conference room. It's the Portsmouth room.
Yeah.
And it's open to anybody. You can come, and it's a public meeting, so it's open. You can come and take a look, and you can get in touch with me through the information that's on the screen now, and I'll be more than glad to talk you through it. And you're welcome to come and sit in or ask any questions you'd like.
Yeah, I would also recommend going to the town website and going to your page on there, which has some information about background.
It does, and hopefully once they get the new information up, it'll be more timely, because what's on there right now is outdated by a couple of years.
Yeah. Let's talk about some good news stuff here. We got Project Purple coming up.
Yes.
Could you talk a little bit about what's planned for that?
Project Purple, as everybody I hope knows, came about through Chris Herron and the Herron Project, and it's when Chris was giving a talk and he noticed that there were some kids in the front row that had purple on, and he asked them, "What are you doing?" And he said, "We are the students who have made a choice not to get involved with drugs and alcohol." People started laughing at them, and Chris said, "Hold on a second. These young people are the people that really can make a difference." So it's grown from that. Portsmouth has taken that on. There's going to be a proclamation. You're going to see purple bows, ribbons. I would hope that you might want one on your door.
Absolutely.
Or your box. And if you take a picture of it and put it on our Facebook page for the Portsmouth Prevention Coalition, you might be lucky enough to get a free purple T-shirt.
Okay, now where can we get those at?
You can get those, the bows, you can get them at Carlone's Florist, who have been so helpful to us. The coalition is going to be manning a table at Clemens Market this Saturday from 10 to 1, where we will give things away. We're taking donations for the coalition, but
Sure.
you don't have to buy something. We'll give you something for your kids or for your house as well.
Yeah, I noticed you have a purple tie on. As I told you, this isn't purple, but it's sort of a reddish purple, perhaps. But we definitely need to get out there and support this. So what are some of the events coming up with?
There's most of the, and the whole purpose of this is to congratulate those students who are most of the students who make good choices. Yeah. The Patriots committed. I think the biggest event is the 3rd annual dodgeball tournament that will be at Portsmouth High School on Friday night at 5:30. ESPN.
Next Friday.
Next Friday, right? Yeah. Not today.
Okay.
ESPN, Nesson. I know they're all going to be there because it's actually one of the funnest things that you can possibly go to. There's an adult teams, 5 people to a team. All the money raised goes to the Patriots community, and there's a student team, and then the fire department and the police department go at it. And whoever wins between that, Donnybrook.
Yeah, we're taking bets in the back room there.
I know, everybody. I got money on it too.
I'm not going to ask you who you're supporting.
No, I can't.
Yeah, you can't do that.
That's one of the things. But in all the classrooms and throughout the town, it's just recognizing those kids and thanking them for making good choices.
And the great thing is it's driven by students, which is super.
Yes.
Thanks for joining us, Ray. We're down to less than a minute, and I'd like to just repeat my invitation always to you to come on the show anytime you want when you have something to tell people, and we'll see if we can't help in doing that. I hope everybody gets out there and supports certainly Project Purple. I think our kids need to know that we support them, and they need to know also the real dangers of substance abuse. I think Project Purple is a good way to show that we care about them and their future. Thank you for all your efforts, and I really appreciate it.
Thank all of you for this, and for parents, talk to your kids. Have a conversation with them about this stuff.
Yeah.
That makes a huge difference.
And I'll see you down at Clements tomorrow.
I'll be there tomorrow morning.
I want to buy something purple.
All right.
Okay, Doug Smith here signing off. See you next time. Thank you.